As of January 1st, 2026, Pennsylvania Medicaid has made a major change to coverage for popular GLP-1 medications like Ozempic, Wegovy, and Zepbound. Adults who rely on medical assistance for weight loss treatment are now being told that coverage will end unless they meet specific medical criteria. At the same time, there's been growing confusion online about gym tax credits, political motives, and what options patients actually have. In this video, we're breaking down what's changing, what's not, and what this really means for Pennsylvania Medicaid patients. And it's important to understand that Pennsylvania is not acting in isolation. Across the country in 2026, Medicaid coverage for GLP-1 medications varies widely by state, creating a patchwork of access depending on where you live. Hey everyone, welcome back to the channel. Pennsylvania Medicaid, also known as medical assistance, began covering GLP-1 medications for obesity and weight loss in 2023. Demand grew rapidly. By 2025, the cost of covering GLP-1s reached an estimated $1.3 billion in a single year, making it one of the fastest growing expenses in the state budget. In response, the Shapiro administration announced a policy change that took effect on January 1st, 2026. Here's the key point. Pennsylvania Medicaid will no longer cover GLP-1 medications when they are prescribed solely for weight loss or obesity in adults aged 21 and over. Importantly, GLP-1s have not been removed entirely from Medicaid. Coverage continues for adults with type 2 diabetes and adults with other FDA-approved indications, including reducing cardiovascular risk, obstructive sleep apnea in people with obesity, and certain liver diseases, including MASH. However, everyone, even those who still qualify, must obtain a new prior authorization to continue coverage after December 31st, 2025. This includes adults with diabetes, patients using GLP-1s for non-weight loss issues, and people under age 21. Without a new authorization, coverage ends. For children and young adults under 21, the rules are different. Federal Medicaid law requires coverage of all medically necessary treatments for people under 21 through a program called EPSDT, Early and Periodic Screening, Diagnosis, and Treatment. That means that GLP-1s can still be covered for obesity or overweight patients, and plans cannot deny medical coverage simply by saying weight loss drugs are not covered. If a denial happens, it must be justified and it can be appealed. Many Medicaid recipients received letters stating that GLP-1 coverage would end on December 31st, 2025. These letters were sent broadly, regardless of age or medical reason, which has caused quite a bit of confusion. According to patient advocates, anyone who believes the letter was sent in error should appeal the decision through their Medicaid Health Choices plan and ask their doctor to submit a new prior authorization effective January 1st, 2026. Timing does matter. Appeals filed within 15 days of the letter may allow coverage to continue during the appeal process. State officials say the decision was driven by cost. When GLP-1s were used mainly for diabetes, Pennsylvania Medicaid spent about $223 million in 2022. After coverage expanded to obesity treatment, those costs surged to $650 million over the next 2 years and to more than $1.3 billion in 2025 alone. Lawmakers from both parties have described the program as financially unsustainable, even while recognizing the medication's medical benefits. Some clinicians and legislators argue that the cuts may cost more long-term by increasing rates of heart disease, kidney disease, and other complications. Pennsylvania's decision is part of a much larger national trend happening in 2026. Medicaid coverage for GLP-1 medications like Ozempic, Wegovy, Mounjaro, and Zepbound is not federally guaranteed for weight loss. States are allowed to decide whether or not to cover these medications for obesity alone, and that's led to very different policies across the country. Some states, like Pennsylvania, are restricting or ending coverage for weight loss only use in adults as costs rise. Other states are taking a different approach. Beginning in mid-2026, the Centers for Medicare and Medicaid Services is launching a new voluntary pilot program called the BALANCE model. States that choose to participate will be able to negotiate lower drug prices for GLP-1 medications and potentially expand access, but with an important caveat. Under this new model, GLP-1 medications are expected to be paired with lifestyle interventions, including diet, nutrition counseling, and physical activity support. Participation in this model is optional, which means that some states may join, others may opt out, and coverage will look differently depending on where you live. One thing has not changed nationally. Medicaid coverage for GLP-1s used to treat Type 2 diabetes and other FDA-approved medical conditions generally continues, even in states that are cutting coverage for obesity alone. So in 2026, we're seeing a patchwork system, with some states expanding access through negotiated pricing, others pulling back due to budget pressure, and patients that are caught in the middle, depending on their diagnosis and their zip code. You may have heard claims that Pennsylvania is replacing GLP-1 coverage with gym tax credits, and that is not accurate. The gym tax credit idea did not come from Governor Shapiro's administration. It was proposed by two Republican lawmakers, Senator Joe Picozzi and Representative Joe Hogan. The proposal would offer up to $1,000 in tax credits for fitness memberships. As of now, no bill has been introduced, no legislation has passed, and the proposal is not part of Medicaid policy. So what does all of this mean for patients, especially those on Medicaid? Here's what matters most in 2026. Medicaid coverage for GLP-1s depends heavily on your state. Coverage for diabetes and other FDA-approved conditions is far more secure. Coverage for obesity alone is increasingly uncertain. New federal programs may expand access, but only in states that opt in. And prior authorizations, appeals, and documentation are more important than ever. If you're on Medicaid and using a GLP-1 medication, check your state's specific policy. Confirm what diagnosis your prescription is tied to. Talk with your doctor about medical necessity, and contact your state Medicaid office or managed care plan for the most current information. What we're seeing in Pennsylvania reflects a national reckoning over how obesity is treated in our healthcare system and who gets access to effective medications. These decisions are deeply personal, and they affect real people who are trying to improve their health, reduce risks, and live better lives. If you're impacted by these changes, please know this: you are not alone. There are paths forward through appeals, medical documentation, and staying informed as policies continue to evolve. My hope is that sharing this information helps you to advocate for yourself and feel supported during what can be a very discouraging process. We see you, we hear you, and we are in this together. If you found today's video to be helpful, don't forget to like and subscribe to continue receiving updates like this and to follow along with me and my own GLP-1 journey. Thank you so much for watching today, and I'll see you in the next video.